External landmarks. You ready? You recording now? Okay, the external landmarks, your pulmonary trunk, and then your aorta curves over the pulmonary trunk. The apex region is here. The base of the heart is the wider region. The sulci, you've got your anterior interventricular sulcus, your left coronary sulcus, and the right coronary sulcus, and the posterior interventricular sulcus. That's all the sulci that you'll have. Now, I'll call the sulci grooves. I'll say, name this groove, and have a pin stuck in it. Okay. All right. Then the vessels that you need to know. In the anterior interventricular sulcus, you'll have your anterior interventricular artery taking the oxygenated blood to the ventricles. The great cardiac vein will be collecting the deoxygenated blood and will move up toward the left coronary sulcus, and the great cardiac vein will turn, go all the way around the back of the heart where it will enlarge into your coronary sinus. The coronary sinus will dump that deoxygenated blood back into the right atrium. All right, let's see. Mention the anterior interventricular artery. That is a branch of the left coronary artery. Now I won't ask the left coronary artery because it branches right when it gets here. So the anterior interventricular artery, and then the circumflex artery is the other branch of the left coronary. All right, so if I say name the large artery here, left coronary artery. Name the large artery here, anterior interventricular artery. The large artery found in the right coronary sulcus is the right coronary artery. And then on the posterior aspect of the heart, you have the posterior interventricular artery. The only vein I ask you is the great cardiac vein. It's the only one you have to know. You do have to know where it enlarges. It forms the coronary sinus. I think that's everything on the outside of the heart.
Do you ask the auricles?
I did not say the auricles. Okay, the flappy structure, the external part of the atria is called the auricles. This is the left auricle, and this is the right auricle. Now the chamber is the atrium inside. Okay, so auricles, the outer part, the atria are inside. Okay, I think that's everything. All right, then on the inside of the heart, let's do the muscles first. All right, so the walls of the ventricles are myocardium. If I say name the muscle, that's what you're going to write, myocardium. If I put a pin in this bulging muscle inside the ventricle, let's see if we can find one in this right ventricle too. Not a very good one there. Well, that's the best one. But if the papillary muscles are going to be attached to the chordae tendineae. All right, so that's papillary muscle. And then inside the atria, okay, inside the atria, these ridged muscles here, if I have a pin here and say name the muscle, it'd be pectinate muscle. So pectinate, papillary, and myocardium. Now if I say name the structure between the two ventricles, then the structure is going to be the interventricular septum, and I've cautioned y'all not to do intra. Make sure you have inter, because those two prefixes mean different things. All right, if I want you to name the left ventricle, then I'm just going to put a pin here and say name the chamber. Right ventricle, left atrium, right atrium. The valves, okay, remember on your left side, lab, the lab part, left atrium, you'll have your bicuspid or mitral or left AV. Okay, on the right side, all right.
Tricuspid.
I was trying to get a piece of it up here, thin membrane. I've already mentioned the chordae tendineae. I'll probably just put, a probe beneath the strings and say name the strings. The aortic semilunar valve going from the left ventricle into the aorta. Okay, here. Okay, there's aortic semilunar valve.
You won't ask that on this heart though, will you?
Might, it's right there. The one I can't ask on this heart is the pulmonary semilunar valve. It's easily seen here, whereas the aortic semilunar valve is real hard to
Back
see.
there.
It's way up under there. But aortic semilunar valve is easy to see on the pig heart, but you can't see the,
So it's that little white piece right there?
it's this little thin membrane right here. See how it
Okay.
makes a little cup? And then here's another one, it's kind of, that one's cut. The rest of it is right here on the other side of the heart. It's from the left ventricle going right up into the aorta.
Okay.
So like I said, pulmonary semilunar valve on here. The veins, I should have done the pulmonary veins and arteries when we were doing the external landmarks, because once your pulmonary trunk branches, you got your left pulmonary artery and your right pulmonary artery. You got your right pulmonary veins bringing the oxygenated blood back to the heart, and your left pulmonary veins bringing it back to the heart. The inferior vena cava, superior vena cava. Let's see if I can locate them on this pig heart. That's the back side of the heart. There's the superior vena cava. And there's your inferior. Okay,
Those be asked on the model or on the live part?
just like this. So if I'll have probes through there, you know, so you can see them, and then I'll have a pin in one or both. Okay, I think that's everything. Just checking. It's everything.